Hi guys, we're going to do some glenohumeral passive physiological and passive accessory mobilisations for you today. So we're going to start off with the straightforward passive physiologicals for the shoulder, starting with flexion and extension. So looking at these in the sagittal plane as a pure movement this time. So starting off then, we're going to take hold of the wrist and of the elbow, and then we're going to bring the arm up. So remember, we're checking here for how much motion they have and where resistance is, as well as where pain is. As you start to come up, as long as they have free motion, as we do here, we allow the arm to come up, and as it comes up, let it rotate. You'll see here that the arm is twisting round. If you try and hold it out here, you'll find it's very unnatural, and they won't feel that particularly nice either in their glenohumeral joint. So allow that rotation to occur, taking it passively right the way up into flexion, into resistance, and we're here going towards our end of range. Of course, with our grades, depending upon where pain was, if we were coming up here and we found pain just at this point here, then we would just back off ever so slightly, and then we could start, for instance, with a grade 1. Nice and gentle with your motion, not going too fast. If we were to come up, say, and find pain here, again, this is in our test movement, we can back off and go into our grade 2. Equally into 3s and 4s now, so resistance, just about starting here. I can start to feel resistance, pushing through. Pain, say, is there, we will back off, and then press into our resistance range with our grade 3. Remember, that can be in and out of resistance, doesn't have to all be in resistance. And then with our grade 4, typically for end of range, but doesn't have to be, feeling for our passive resistance and pain, back off slightly, and then our small movement of grade 4. Okay, for extension, quite simply, it's very much the same motion. We're just going to be dropping the arm down. Just move slightly towards me a little bit to see your arm is right off the end of the bed. So you can't see quite really from that camera angle. A bit more, just with the body, and here, perfect. So the shoulder here is basically off the edge of the bed. So we've got the body at a slight angle, so the head is up at the very top far corner of the bed. And when we're coming into extension now, we're just going to take hold of the hand left to left so that we can grip and take a good hold, holding onto the elbow and then allowing the arm to glide down and past the bed. And this is why it's really important where they are when you're doing your extension. Okay, and then for my grades, so for instance, pain, say, is there. For my grade 1, then we're just lifting away. Nice and supported as well with this hand just on the elbow. So I'm on the outside of the elbow and also fingers coming underneath. So remember, the more you can give that sense of cuddling the area, the more they're going to feel stabilised. Grade 2. Let's come into a slightly further into range, so there's pain here, back off, and then my larger movement. Grade 3, into resistance, again backing away, and then going up to, or just before that point of pain. And finally with my grade 4, let's go for an end of range extension here. So I'm really using this lower hand now to push the arm round into resistance towards the end of range. Pain, say, is just there, back off slightly, and then I'm pushing the arm towards that end of range. Good. Okay, so another motion we need to consider is flexion in the plane of the scapula. So all we have to understand is that the scapula is where our glenoid essentially comes from, but our scapula is orientated round and forward. So it orientates the fossa around about 30 degrees off the lateral point, taking it slightly anteriorly. And so therefore, when we're looking at flexion extension in the plane of the scapula, we have to take that into account. So when you're then looking at it from a body perspective in here, then the arms would be, rather than looking at flexion pure, okay, what we would do is we can turn our hands out and then come up and away and then back into the body this way. And what you'll find is that when you then do that in your patient, in terms of their motion actually is a lot freer. Okay, so from here, just bringing the arm up and into flexion there, and then back down. So we're allowing the arm to follow a natural arc. Yeah, so it's a natural arc of motion. Okay. So so when we're going to be doing that, same handling, same positioning. It's just you've got to control it in at a slightly different angle with the arm coming outwards. Okay. So we're going to come up, and again we can allow the arm to bend, and then taking it up and in towards the head. And again, with all of my grades, same handling. We can hold onto the elbow, taking it up towards our end of range, or if we're part way into range. It just depends upon where your patient says that they've got their pain and where they've got their resistance as to where you then do your grade. Okay. All right, next up we're going to do horizontal abduction and adduction. So we're looking at there, so it's also written sometimes as horizontal flexion and extension. So top tip, they're exactly the same thing, just a confusion in terms. So what we're looking at here is coming across the body, a little bit like you're making a scarf around them, and as you move into your shoulder assessment components, this is very similar to a scarf test. So bear in mind if they do have any issues in their AC joint, this might cause you some pain. And then down and back here as we come out into horizontal abduction. So horizontal adduction, horizontal abduction. And you can see again we're supporting at the wrist and at the elbow to control the shoulder motion. So coming across here, we're then going to come across the body, and the motion really is pushing through the elbow with this hand supporting at the wrist. So going up to and trying to find our point of resistance as well as our point of pain, wherever that patient then reports to you, that's where you're then going to do your grade. So for instance, this could be a grade 3. There's a larger motion heading up into resistance towards my point of pain. We could come back here. This could be my grade 2. Yeah, so again, large amplitude up to the point of pain. There's a 4, so we'll be testing the range, feeling for resistance, feeling for pain just at that point, back off, and then press towards. In all of these, it's really important as well that you're using your body appropriately. So this is relatively arm heavy in terms of when you're applying your pressure, but also have your body so that you're in a walk standing position, so you have that ability to push forwards from the body. Don't stand square on here. If you stand square on here, you're really having to use your arms, but you're also going to be using your back because you're going to end up bobbing back and forwards to try and apply your pressure. So please don't do that. Equally, when we're coming outwards now into horizontal abduction, taking the arm out and away and down here. So again, making sure that the edge of their shoulder is off the side of the bed. Down into horizontal abduction, feeling for any point of resistance. Let's just say that they find pain is just there, so I'm in resistance already. I can back off and then say do a grade 3. Again, you can see walk standing position. If I stood like this, I'd get a very bad back very quickly. Okay, you're standing in here, closer to your centre of mass as well. Okay. Next up, we're going to do abduction, so pure abduction. We technically can't really do an adduction motion as long as their arm can go down by the side of their body. This is their 0 position, so as long as they can get to there, that is it really for the basics of adduction. But for abduction, we're going to be taking the arm out and up into abduction. We need to consider now whether we're looking at pure glenohumeral or whether we're going to allow scapulothoracic motion as well. So we'll break that down into 2 parts. First of all is the hold. So their hand goes around your elbow or anywhere in towards your humerus. You're holding onto their elbow though. That's a really, really important factor. Obviously it depends upon your length of your arm to theirs. And that then gives you the ability, so if you're nice and relaxed for me, that we can have that arm secure and supported without this hand having to be involved. Okay, so this arm can then come right out quite easily, and so I can then use my body to apply my pressure and motion. This hand is then used, for instance, if we looked at pure glenohumeral abduction, then what we're going to want to do is to stabilise the scapula. So we're actually having to push it down and keep it down. So from here, if I apply pressure there, so I'm depressing the shoulder, and then pull this arm outwards, what you'll find is you get to around 80 to 90 degrees, and it just starts to really limit and stiffen up. Also for the patient, clearly if there are any subacromial impingement type issues, then this will be very painful, so you don't want to be doing that. You're not trying to achieve that. Here we're looking at normal motion in a normal shoulder. If we had a glenohumeral joint that perhaps was only coming to here, say, so around 45, 50 degrees, then that's a problem that we can help with this, but we wouldn't want to let go, because then what would happen would be the scapula might start abducting out, laterally rotating, just allowing that motion to happen. So we want to focus our movement here, in this case, on the glenohumeral. So coming out, so let's just say that was coming up towards our end of range, they're finding some stiffness, maybe a little bit of pain. So we'll say we're in resistance, clamping that down, and then we're going to come away and back towards that point of stiffness and pain, say with a grade 3, as demonstrated here. If that's not a problem, and if you actually are looking to get scapulothoracic motion, then of course you don't need to clamp that down. In which case you can then use this hand just to add additional support to the arm, and then you're going to need to find out where your motion is. So it's very important that you have your legs in a position where you can move them and you can then flow with them. There's nothing worse as a patient when you've got a painful joint when someone's constantly jigging around. Okay? So try and make sure that you are there and available to come out into the motion that you need to. If they have more motion than this, then no problem at all. Let's pause it. Let's come to here. Okay, now let's see what happens when we come out. Okay, now we're getting there. Nice bit of resistance. We're coming towards the end of range. So for instance, if we had, say, resistance and pain just there, then we can back off, and then we can move into our grade 3. Especially with my grade 3, I'm really going to use my body and my legs, as opposed to body still and just using my arms, because essentially this is harder work for me, and why do I want to work hard?